Healthy Beginnings, Hopeful Futures, and it will urge governments and the health community to ramp up efforts to end preventable maternal and newborn deaths and to prioritize women's long-term health and well-being. And as you know, we kick off this year's campaign, and based on current trends, a staggering 4 out of 5 countries are off track to meet targets for improving maternal survival by 2030, and 1 in 3 will fail to meet targets for reducing newborn deaths. So we can go to the website to find more about the World Health Day, but also about the campaign and how to get involved to support the campaign. So yeah, with that, I will hand it over, and without further ado, to Rondi, our one of the co-chairs of the RMNCH working group, to introduce today's session and our guest presenters. Over to you, Rondi.
Thank you. Yeah, I sort of started my day knowing that this was World Health Day, but then when I got on the internet, I was like, wow, there's so many things happening. There's WHO is coming out with this statement that you're talking about, and there's a midwifery accelerator launching in New York City, which I think is at 1:15 East Coast time, and so it's an exciting day. It's in some ways these are times that it's hard to be hopeful, but I hope that we can feel some hope around this. So the Maternity Foundation and the Safe Delivery app is an organization that has been doing great work for a long time. I've been aware of it, I don't know when, maybe since 2017 when I was in Bangladesh. The Maternity Foundation worked with UNFPA, who I was then with, to get the app translated into what Bengali or Bangla. And then when I was in Syria in 2023, I also worked a lot with holding meetings for midwives in rural Syria and trying to get it downloaded onto people's phones and get them filling out the certificate. So it's an exciting app, and I think that it's already doing great work, but I think that the potential is even greater. And oh, we also have a current launch in Indonesia of getting the Safe Delivery app translated, and so I'm excited about that project. So Hilda, I'm going to turn it over to you, and maybe you can introduce your team, and we look forward to this presentation.
Thank you, Rondi, and thank you so much for giving us this opportunity to present in your working group. Very excited to be here and to meet you all. So I'm here with some of my team members. So Amanda is our program coordinator, and she helped me with the presentation also, and she will show the slides. Thank you, Amanda, for that. And then Julie is here as well. She's our head of programs, and she will also assist with responding to some questions you might have. And then we have Christina here. Christina is our head of HR and operations, and so it's more I mean, she was interested to follow this webinar and also to understand maybe what are questions that our partners and global stakeholders are asking, and so she's following also. And so I'm Hilda, and I'm the program director at Maternity Foundation. So welcome all. I will ask you maybe to, if you can shortly introduce yourself in the chat. I mean, we see your name on the screen, but where you work, for which organization you work, that would be really great. But there will be time for a Q&A at the end also. But please ask already clarifying questions in the chat if you wish to. Thank you. Next slide, please. So if you haven't yet downloaded the app on your phone, maybe, and if you're interested, of course, this is maybe the time to do it. It can take some time depending on the internet connection speed you have. But so these are the QR codes for downloading on iPhone and on Android. And so today we will speak about Maternity Foundation, the Safe Delivery app, but more in general, the Safe Delivery Plus program, our training approach, and then we have some slides looking at our evidence and the dashboard we have. Next, please. Thank you. So we are an international NGO. We focus on maternal and newborn health, but more recently also more on the whole continuum of care, on midwifery care. And since the foundation was started in 2005, working in Ethiopia, a small NGO, but became quite big. We have now 3 global hubs, one in Delhi, India, one in Ethiopia, and one in Copenhagen. And we are around 40 people, in all hubs included. Our vision is that it should not cost life to give life. Next, please. Okay, so to introduce us, I will show you a little video that was made in Ethiopia last year. So it's a short video, but I think it gives a nice overview of what we do. Is the link working?
Yes, I'm just trying to share my my screen of the video. One second.
Okay. Yeah, no worries. Take your time.
Can you all see the video now?
Yes, it's paused, but we see it. Yeah. Not sure the sound is working.
Yeah, I don't have audio.
No, audio is not working for the moment.
No?
No audio.
Hilde, I think the video is also coming. We can play it on a slide that's coming in a few slides.
Yeah, perfect.
I think that one's integrated in the PowerPoint, so it should be easier to share that one. Let's
Yes.
try that.
Okay, I think you're all SRH experts, and today the new statistics came out, and so we haven't yet had time to adapt this slide, but now we have statistics up to 2023. But from what I've read already, unfortunately, not a lot has changed. Of course, compared to 2015, yes, things have changed, but now when we look at the Sustainable Development Goals, it will be quite difficult if we continue at this pace, the reduction of maternal mortality, to reach a target of a global average of 70 per 100,000 live births. So again, also, I mean, this is so the slide from before today, but it's still the same a bit. It's still a bit the same picture we have. So it's still every second minute a woman dies, even if there has been a reduction. A lot of newborn mortality as well, still going down, but still quite astonishing how many newborns still die. And then 70%, I think it's even a bit higher now with the new stats. More than 70% of the maternal deaths are happening in sub-Saharan Africa. And then we still see a lot like before also, a lot of mortality is happening in conflict areas. And in humanitarian settings. So we also know that most of those deaths are preventable, and so that urgent action is needed if we want to reach the Sustainable Development Goals. Next, please. It's not only about mortality. We also know that around 20 to 30 women suffer also preventable injuries or infections, or become disabled, or have a very low quality of life after childbirth. And that's also important, of course, to to take into account. It's not only about women dying and newborns dying, but it's also about how pregnancy and childbirth can affect their overall health and quality of life. Next, please. So we also know that investing in midwives is critical, in midwifery care is critical, because we know that midwives can provide up to 90% of all the maternal and newborn health services. We also know that only 20% of practicing midwives in sub-Saharan Africa, for example, have the sufficient midwifery skills to provide all these services. So there is really an urgent, I mean, it has been on the agenda, of course, since years and years, but a continued need for investing in midwives, in midwifery education and pre-service, but also in service, to ensure that they remain competent over the years, and that also their knowledge and skills are adapted to the newest evidence. Next, please. So our Safe Delivery Plus program and the Safe Delivery app. So just to, yeah, thank you. So what is a Safe Delivery app? The Safe Delivery app is, we call it the core of our work. It's like the heart of our work. It's a free digital job aid and learning tool, and it's designed to help midwives increase their knowledge and skills to prevent and manage the most common complications during childbirth. And it's really at the heart of our work, but it's more than just an app that we have developed, of course. It's based on evidence-based guidelines from WHO. It covers the continuum of care. We will see that later with the modules we have in the app, and it gives really a very practical step-by-step guidance with instructional videos that are animated, with action cards and many other features that I will talk about later. And it's really made in a format that is engaging and that will encourage micro-learning. And then we have also the My Learning platform, which we will go over a bit later. And it is fully functional offline. So that's really, it's free and functional offline. So that's really a major advantage of this app. The program ensures that the app, but also our training approach using the app, reaches and supports midwives in also the most remote settings. That's really important. And so to do that, we will always try to adapt the content to national guidelines, local languages, and the cultural context. That's very important for us. It's not just an app that can be used by everybody. We know every context is different, that there are also differences in guidance in the different countries, and it's very important for us that we contextualize it, that we adapt it to that, and that it's not just one version for everybody. Our program uses simulation-based trainings. I'll tell later a bit what kind of trainings we do. And we also facilitate communities of practice. This is for peer-to-peer knowledge sharing and motivation and continuous engagement. Part of the program is also what we call institutionalization of the app or integration in the ecosystem. And one example is, for example, that the app can be accredited as for relicensing, so for the continuous professional development and the relicensing of the diploma of the midwives. Next, please.
Here comes the video again, so just give me a thumbs up if the audio is working this time.
Okay.
In 2005, Maternity Foundation began its journey as a small Danish NGO, and today we are proud to stand as a global leader in maternal and newborn health. Our work centers on the Global Safe Delivery Plus.
It's not very loud.
We have reached over 455,000 midwives and other health.
Sorry, it's not loud enough.
Safer births.
At least for me.
Reality that every single day.
Okay, let's see.
Over 6,000 newborns.
It also comes in the PowerPoint, in fact.
Yeah, when I try to press the big screen, it says it's not available. Sorry.
It's okay. We can maybe show it at the end.
Yeah, we can also send a link maybe in the chat.
Yeah, that's great. Yeah, and then we can
Great.
take some time at the end. Thank
The
you.
app is free and works offline, making it possible to reach any midwife any.
Yes, so our Safe Delivery Plus program is really more than just the Safe Delivery app, which is at the core. So I've said it already, we contextualize content, visuals also. We have different visuals in the app depending on the region where it is. So we have the African visuals, we have the Asian visuals, we have the visuals for Muslim countries, etc. We do in-person, online, but also very much blended trainings. It's used in pre and in-service learning, and there are accreditation possibilities. And our work is based on evidence and research activities. So not only we base our work on evidence, but we will also try in all our projects to include research activities, monitoring and evaluations, and to produce learnings also for ourselves internally, but also, of course, externally to share. We work in partnerships. That's really very important for us, and that's also why we can stay quite small while having a big impact, because we will never do a project without having partners on the ground. And those can be multiple, going from UN organizations to NGOs, going through midwifery associations, etc. Some of our donors are also at the same time partners in countries. So it's really various kind of partnerships we have. But we will always have a partner in country or in the region to support our work and to roll out and engage with the Safe Delivery app in the Safe Delivery Plus program. The adaptation and embedding into national systems, yes, we really rely on to engage further and to make it sustainable, to make our program sustainable and the SDA sustainable. We ensure that it is really embedded in national systems and structures, whether it's in midwifery institutions, so in schools, in the curricula, in the mentorship, existing mentorship program, in existing trainings done by the Ministry of Health or partners, etc. The My Learning component is also very important because this is really the individual My Learning of the user, and we continuously adapt it also, and we will try in the future also to have a much more active engagement with the user through some nudging and some features in our new Safe Delivery app once we have developed a new platform. I will talk a bit more about that later. And then the community of practice, we have been developing small communities of practice, but starting this year, we will try to have bigger communities of practice for trainers, but also for users. And it can involve even through partners, etc. That's really an ambition we have starting this year. Next. So where is the SDA used? Well, it's used globally. Until the end of 2024, we had more than 455,000 users of the Safe Delivery app. We have the two big country programs in Ethiopia and India. There we have a team on the ground, but we work in many other countries in the different regions. So we call it our regional portfolio. So we have one in Sub-Saharan Africa, excluding Ethiopia, because that's one country program, Asia and the Pacific, Latin America, and the Middle East and Northern Africa. We have users currently in more than 70 countries worldwide. Next, please. So the Safe Delivery app, maybe some of you have used it already. So as I said, it's free. It works offline on both smartphones and tablets once downloaded. And when you go then again online, you will get some updates available. Maybe there is an adaptation on a module. Maybe there's a new module in your version, and you will get a notification and you can update your app once you are online. It comes in 5 global versions based on WHO guidelines: English, French, Arabic, Spanish, and Portuguese. And we as an organization commit to update a module within a year of the release of new guidance. For example, the bundle of care for PPH and heat-stable carbetocin has been included in the app now in the English global version some months after the new guidance came out. We have 30 plus language versions. When we say language versions, it's country versions, in fact, so we adapt to national context. So what is done is that the whole content is being compared to national guidance and we adapt it, and it's a review committee who does that normally. It's what is going to happen or started happening in Indonesia, and then our experts will look, is this feasible to adapt, yes or no? It's adapted, then there is translation if needed into the national language, and images can also be adapted. And so, yeah, the app was developed in 2013, tested and launched in 2015, and it was developed based on research in collaboration with midwives, so by midwives, for midwives, with universities in Denmark. Next, please. So these are the versions. I will not read them all. So we are also making some new versions. And so the aim is also that the ones existing, we always try to find partnerships to continue updating them, because our global version is getting bigger and bigger with more modules. Yes, next. These are the modules existing in the global versions for the moment. The only one not existing yet in the global version is the gestational diabetes, because this is a pilot project. It's in India, funded by the World Diabetes Foundation. The project is nearly finalizing, and then we will try to have the gestational diabetes that is now based on Indian guidance, also in the global versions based on WHO guidance. But as you can see, it really covers the continuum of care. Also some transversal modules are there, like infection prevention, perinatal mental health. And so we go from contraception through all the BMONC modules, all the newborn modules, safe abortion is included. And we also have a module on female genital mutilation, which of course is not relevant in all contexts, but it is included in the global versions. Next. So what is in the Safe Delivery app? So we have videos. They're always short, maximum 13 minutes. And they're also split up into even shorter videos when you want to just focus on, for example, the definitions, the causes, the management, etc. And so by module, you have the videos, you have the action cards, which will go deeper into what is in fact said in the videos, practical procedures, that's really the paramedical procedures, and then we have a drug list by module, but you can also access the drug list by going in the top corner, and then you have the list of all the drugs that are used in or mentioned in all the modules. And then there is a My Learning component. We can go quickly over each feature, but I think probably the best is also to start using it, but we will go quickly over the different features. Yes, so when you download the app, you will see, you first have to choose your version, and then you will see the different modules in that version. Next. Then, so the videos is really divided into sections. You can watch them individually. You can also watch them together with your colleagues. It can be watched together during a training. So it can be used also in a training to look up some things if you want to include some exercises, etc. The action cards are the recommendations in writing. It's really coming from the videos, but you will see all the steps, and it's a quick reference if you want to quickly look at the actions for example, Amstel. It will be written out, still short, but still differently than in the videos that you have to listen and look at. Practical procedures, it's really about certain, I mean, not procedures, but also other things. I mean, not, it's also actions, of course, but it's a bit different. It will really look at the very practical procedures, like you see here, some examples on the screen. Yeah, the drug list. So you can go into your module and look at the icon, the capsule icon, and look at the drugs from that module, but you can also look at all drugs. And so the drugs, it's not mentioned here, but it will give you also, I mean, the usage, the contraindications, the side effects, etc. And then next, please. Yes. And then we have the My Learning. So the My Learning, so you can, after each module has a My Learning part. So it's an e-learning platform. So in the app itself, you can start a little exam on the module. It's game-based. It's multiple choice, but also moving some answers around, etc. And you can test your clinical knowledge on the subject, on the module. So you'll have a first set of questions, and if you respond them all correctly, you will get a familiar level, 1 star. Then you get another set of questions, 100% succeeding 100%, so answering 100% of the questions, you will get 2 stars. And then the last level, level 3, is the expert level. So the questions become more and more difficult. Once you're an expert in all the modules, you will be able to proceed to the champion exam. And for the champion exam, it's not 100% pass rate, but you need at least 70% to become a safe delivery champion and gain a certificate. The good thing also is with this is that you can look which answers were wrong, and you can continue to learn and look up the right answers, etc. Yes, these are some examples of questions. Next. Yes, this is about the certificate, so you can unlock it. It takes around 3 to 4 hours to do the full exam, and then you can get your certificate. When you log in fact, when you create a user account, you will have to enter either a WhatsApp number or an email, and the certificate will be sent to you. And then we can also individualize this. For example, if you say in your organization you want, your target group of midwives to encourage them to get the certificate, we can also put your logo, the logo of the Ministry of Health in there. And so it can also account for CPD points if the certificate has been registered as accredited as a CPD course. Next. So our training approach, so as I said, we have, of course, the app, and we integrate the app and we use the app, and the app is really a job aid and a self-paced learning tool, but we also use it in our trainings. And what we use is we really use micro-learning, low dose, high frequency. There are different terminologies for it, but we want to go from the conventional classroom teaching to the self-paced micro-learning on the job. But this, of course, we will still do classroom training, but it will be very practical, using adult learning principles, and then showing them also how they can continue using the app and using exercises and using what they learned during the classroom training to on the job at their own pace or integrated in other trainings in the healthcare facilities. So it shows also that there is much more retention. It's proven that there's much more retention when you do it in short trainings, and that the traditional trainings of 2-3 weeks on a subject, I mean, tend to be okay when you have it, but in the long term tend to, we see a decrease in knowledge retention compared to micro-learning education. Next, please. Yes, so our trainings are adapted both to development and humanitarian settings. We will adapt it. It's designed and delivered by our global clinical team. We use adult learning theories. We base it on the professional experience also of the participants, and it's based on global best practices regarding education. It recognizes a lot of participation, and so we also have these personalized champion certificates that I have shown you. We customize our monitoring and evaluation tools, and we try to have competency-based learning, so really personalized and follow up as much as possible the individual that is learning. And we want to also in the future integrate that in our platform as well, so to really encourage individual user in learning and self-assessment. Yes, we tailor, I think that I said already, we tailor to the participants' needs. Of course, every training is different because the participants are different, their expertise, their experience, and also, of course, the learning objectives they might have. And this is also tailored to the partner's requirements or needs. Next. We have different formats. We do training of trainers. We do in-service clinical training, focusing on one or more clinical topics. We do also do just introduction courses, how to use the app, what are the different features, how to get the most out of it, and some deep dives that goes even more deeper in, for example, online, but on certain modules. We aim at, we believe in competency-based learning and also in using simulation techniques. So simulation, practicing on mannequins in a group, supervised, coached, where you can make mistakes so that in the real life, in the facilities, you feel confident and proficient to give the care to the patients, the women and the babies in the real world context. Blended learning is really what we aim for because we also know that in-person training is costly, takes time, and so we always have a blended approach. What we can do online, we do online. What can be done by the participants themselves already to prepare will be done beforehand, and then we complete with the in-person sessions and a lot of practical sessions. Yes, we try to integrate also the whole training, not only our app, but our trainings also. We try to have an integrated and sustainable approach as much as possible, because we know this will have the best impact in the longer term. Next, please. Evidence and dashboard. So our app was tested in a randomized control trial, and we continue doing research about our app. So you will see here there have been some RCTs done, but we also do a lot of qualitative research looking at the experience of the users, and that even helps us improving the app or features in the app. There is an evaluation in the app also, so you can give some feedback in the app, and we will get it and analyze it. And then in all of our trainings, we do pre and post confidence, knowledge, and skills assessments. Skills assessments, of course, if it's a clinical training, but even in our TOTs, training of trainers, we do teach back sessions. That means that they have to teach and they will be evaluated by both their peers, but also the instructors on how they are teaching a group of participants. But so we have seen that in all the studies we did, that compared to the control groups, there is a longer retention of knowledge and skills after using the digital tools, so the Safe Delivery app. And there is an increase compared to baseline, but also an increase even after 12 months when the users are continuously using the Safe Delivery app. Next. So we also have a dashboard. So this is We collect data about the users of the Safe Delivery app. It's anonymized, of course. We don't know exactly who is using what, but we have the geolocalization of the user. So we know, for example, if I, Hilde, here in Brussels, I download the app, it will be seen. And then they will also see, we will see how many times I use it, etc. So we can really have, this is our heat map, and we can focus, this is on the world, but we can also focus on a region or on a country, and then looking at the time period to see how many downloads there have been. And then as you see here, India is our top one country in terms of users. It's also very big, of course, and we have a program there since 2017. But you can see that mostly in sub-Saharan Africa, it is used a lot, but also in the Middle East and in Asia. Next. So we can track users' profiles. So when a user downloads the app, they have to answer some questions. And so we know the profession of the user, the workplace, where they learned about the SDA, and also the years of experience. And we can also look at that by country or by region. Next. And then this is an example, for example, of Bangladesh. So we can also really look at country level, how many active users we have, how many sessions they initiated in the last 6 months, how many modules they visited, how many My Learners we have. So those are users that, you know, the My Learning feature in the app, that have started doing the little exams in the modules. And then you see the number of experts in the country and the numbers of champions. And then you can also see the evolution over time of the number of active users. We can also see how many, the number of times the modules were visited, and the users that access the modules, and also which feature has been used and how many times. So that might give us and the partners insights of what is maybe needed, which modules are most accessed, maybe that can show a need or a gap in their knowledge. Or it can also sometimes show, you see sometimes a peak when there is a training that has been conducted, for example, on postnatal care, then it has been used a lot, of course, by those users. But it gives an overview and can be used for learning. Next. Oh, finished. Good. I hope I wasn't too quick. So maybe we can open the floor, and or maybe we try to do to look at the video. Maybe it's easier when you can share your, not the PowerPoint, and then we watch the video, and then we have time for some reflections, questions, and maybe opportunity to look maybe at your programs also, and where this could be relevant. And there is already a question from Andy. Is the information about users public? No, it's our own dashboard. We share it, of course, with partners if they wish. We tend to share it on a quarterly basis with our existing partners. So the updated dashboard data for the country, but it is not public. No, not at all.
I will try to share the video again. Fingers crossed.
Thank you.
Not
No
working.
sound. No sound. It's fine. It's in the link. People can watch it. It's in Afar in Ethiopia. So where we have a long-term project. In fact, it's a humanitarian crisis situation, protracted crisis since quite some time, and in that region. We have developed with the Ministry of Health a mentorship, catchment-based mentorship program, where the mentors will use the Safe Delivery app and simulation, etc., to mentor mentees in the different health facilities. And so maybe I'll pause here and open the floor to any questions or reflections. Thank you. If you wish, maybe can you tell from the participants here who has the app on their phone already? If you can just thumbs up if you have it. And maybe we could play a little game if you're into a little game, the one we did for the webinar last time. Steven has it, Helen has it.
I think we have a hand up, maybe.
A
Or
hand
maybe
up.
she's saying she's...
Yes, let me. No, I think she was saying she had the app. And for the ones that have been using the app, do you have any specific questions, some feedback maybe for us? Yes, Brooke?
I have a different question. I'm not a user of the app, but I'm just wondering if there's anything that was kind of surprising about the implementation and the rollout of it. Just anything that was unexpected, kind of lessons learned that your team has experienced.
In a specific country or more general?
More general.
Yeah, well, yeah, it varies because it really depends on how the app has been rolled out and how the engagement is in the different countries. What we see, and that's with a lot of things, of course, is that sometimes if that it's really important to continue engaging with the users, because it might be that for short term they are using it, but that there is a need for continuous motivation for using the app. But that's with all educational programs, of course. But we see, I mean, the learnings is, I mean, we users are very happy with the tool because they find it easy to use, very user friendly, intuitive, in fact, and always accessible also offline. So that's really a main learning. What we are also learning, and we're gonna have a cost effectiveness study being done based on our project in India, is that it looks like it's really a very cost-effective way of increasing knowledge and skills, because it's a free app, but it allows a lot of self-paced learning, of course, and yeah, that's very cost-effective. I don't know, Julie, if from your regions you had other learnings, but we have a lot of learning briefs on our website, and like I said, it really depends on the type of project. Learnings now, and I still need to see if we can publish something about it. For example, in Benin, we have adapted the safe abortion module to the Benin context. So in Benin, since a couple of years, the abortion has been legalized. And now I got the feedback from Plan International Benin that they have seen, since the training of the healthcare professionals, combined with community awareness initiatives, an increase in access, in utilization of the safe abortion services. So that's a small example. But our learnings are that, yeah, a lot of learning, in fact. So we have, really depending. And I think, I mean, I hope, Rondi, that in 1.5 years, we will also have a lot of learnings of the use of the app in Indonesia. And yeah, I don't know, Julie, if you want to add something.
There's more questions in the chat too.
Okay. However, how, for example, how, for example, issues? No, the issues of supply chain stockouts, lack of equipment. We don't really measure that. We try to integrate in some projects. So, for example, we hope to have. We're applying for a call with another organization in Bangladesh and Yemen, and they are really working in the facilities. And we're going to try to track outcomes and of course also look at the supply, and so also filling the gap of supplies. In India, where we had in one state where we're having the gestational diabetes training, there is also a reinforcement by the districts of the supply chain, for example. But of course, I'm not sure. We never looked at effectiveness in the use of the app compared to if there is a lack of essential equipment. No, we haven't. And then a question from Duke. Thanks for partnership to extend usage in Kenya. Yes, we are, of course. Please reach out to me. We will send you also the presentation, and there at the end, but I can put it in the chat also. So in Kenya, we don't have currently any partnerships. I can send you the dashboard data because I'm sure there are a lot of Kenyan users because it's a global good. So even if we never had collaborations or a project, there are always users, and we can extend, of course, usage, etc. You can reach out to me and we can look at what is feasible.
I still think we should play the game.
Okay, we can play the game. Amanda, do you have that? It was in the, which one we did the game with Project Hope. Can you retrieve that, you think, or I can look for it?
I will have a look.
We played the game last week with Arpita. Have you used any AI translation dubbing tools for the language versions of your work, and do you use in-country translations? Yes, so that's a good question, Helen. Thank you for that. So for the moment, we are using in-country translators or global translators because, of course, it's very technical. It's a very specific language, and we even do quality control also because it really needs to be accurate. And so for the moment, we are not using any AI translation. We are using it, for example, for training packages as a first translation, like you would do DeepL translation, etc. Because, of course, in our team, we have several nationalities speaking languages, but not all the languages, of course. And then the use of AI more in general in the app. Yes, we have tested a chatbot, we called it, in India. And so we have integrated a chatbot, but so the user can ask questions, and the app will respond. But it's only with information from within the app. So we have trained that chatbot to with adding questions, etc. And so it was always retrieving answers from within the app, and then the users were using it, and therefore also training the chatbot. That has been tested. Unfortunately, we don't have funding to continue this for the moment. We are actively looking for funding to continue this chatbot as a feature because the evaluation was quite good. It was found to be very useful. And we are working on enhancing our platform. So you will not see anything on your app changing, but you will see new features, etc., and also make more space for more versions. So that's in the process, and we hope to have a new platform early next year. And then we will continue adding features and for sure including AI. If possible, translation, yes, would be very, very useful. But also other features like nudging, like hi, Hi, Kate. I see you haven't reached yet the expert level. Do you need some help with that module, etc.? And so we have a lot of ideas, and hopefully with AI, it will be possible in the coming years.
I found the game, so I will share my
Okay,
share my
thank you.
screen.
So for
I just
those,
I just like
yeah,
it because it gets people to see the inside of the app
yes,
a little
yes.
bit.
So even if you don't have the app yet on your phone, it's a little game and it shows, where you can, I mean, it's a game to find certain answers to questions. So Amanda will share the screen, and it's also useful when you conduct training, etc. We have a lot of games and exercises, in fact, that are not within the app, but that we use during our trainings.
Sorry, I just have to scroll through the PowerPoint to get to the game. There we go. This one, the treasure hunt.
Okay, the
game.
treasure hunt, yes. Okay, so you
Yes.
can take your app if you have it. Open your app, and next slide, please, Amanda. Yes, and find the video for bimanual compression. Go. If you found it, you can raise your hand. Yes, Randy.
I I was trying to make it so that you could hear it. It's oh, now I'm playing it and it's distracting me. It's under postpartum hemorrhage, and then videos.
Amanda, if you click on the slide, you will see it comes purpose and hammers, videos, bimanual compression. Yes, so you see that it's a subsection of the full video. Thank you. 1 point for Ronnie. Next one. Find the practical procedure for vaginal examination.
I may be the only one that's doing it. I'm not sure. I've got it.
Go ahead then, show us.
It's normal vaginal delivery, and then practical procedures, and then vaginal examination.
Correct. Next slide. Helen.
Sorry, no, I was
something?
there. I nearly got there. Sorry.
Oh, good. We'll give you some more time. And then
I
I'll
found it now. Thank you.
yeah. So now maybe you will be faster than Rondi. Helen, find the adverse reactions for betamethasone. Yes, Helen.
Yeah, so it's common adverse reactions are mood changes and other mental disturbances, shortness of breath, edema, and diabetic metabolism.
Okay, and so you click probably on the little icon there, search for the B, and then found the drug, correct?
Yes, I did.
Yeah. Okay, thank you. There is also, you can either go to the different, of course, module or the features, but there is also a search option in the Safe Delivery app. But then it brings you straight. So when you train users, it's nicer to show them that they get really to know how is the app set up. It's very, I mean, it's very it's very, how do you say this? User friendly, but still it's good that, I mean, because each module has the same feature and it's good to go over them. Good. Thank you. I think we're nearly at the end of our session. It's nearly 4 o'clock. People are already going to their next meetings, unfortunately. The day is not finished, especially not in your time zone. Do you have any last questions, comments? To repeat, just feel free to reach out to either me if you have a question globally, or to Julie if it's more about MENA, so the Middle East, Northern Africa, or Latin America, since that's her portfolio. But all the other questions I can direct you to the person in charge. We will send you the presentation. Also, if in your organization you're interested for your staff or for certain countries to have a more specific presentation, we can always do that. Very welcome to reach out to us, and we will see when we can book a time slot for that.
Thank you
And
so
I'll-
much. Go ahead. I didn't mean to cut you off.
No, go ahead. I just wanted to wish you a very healthy day. But
Yes, yeah. And just thank you so much. Both presentations that you did have been absolutely excellent, and people are excited to start using them. So thank you for your work.
Thank you. Have a great rest of the day, all of you.
Thank you. Thanks, everyone.
Thank you.
Thank
Bye-bye.
you. Thank you so much.
Thank you so much.
Thank you.